It can come as a surprise to learn that it is possible to reduce the risk of developing dementia. Is it worthwhile trying to prevent dementia?
It is worthwhile trying to prevent dementia. The impact on every individual and their families is enormous. It can absolutely destroy lives for the person that experiences dementia and their families. And we know also that the prevalence of dementia is high now and will continue to increase. And the costs associated with dementia are very high, £23 billion to local authorities, NHS and families. But it's actually the personal costs to every single individual and the many hundreds of thousands of people who are involved in informally caring for their family members who get a dementia. So if there are things that we can do to impact on dementia by intervening in middle age and assisting people in their older age to live healthier lifestyles, which seem to be the indicated means by which we can prevent dementia, then we should be doing those things.
What advice should we be giving to people then?
Well, what's really positive about what we're learning about preventing dementia is the fact that most of the advice we would give to people in their middle age and in older age is exactly the same advice that we would give in relation to physical well-being. Many of the things are the same. So we would be wanting to encourage people to take more exercise, to eat a healthy, balanced diet, to drink within approved limits, to regulate their drinking, to be socially engaged. There's a lot of evidence that is pushing towards not just being physically active, but remaining mentally active. And whilst there's been some talk previously about brain games, and whilst they are always useful and helpful to people, we shouldn't be over-focused on those. It's about social engagement and people remaining interested, staying active in terms of social life, having hobbies, remaining engaged with people. They seem to be some of the things that would be indicated.
Who should we be giving this advice to?
We should be giving this advice really to the whole patient population. It's never too late to give, or too early or too late to give this advice. But what much of the evidence is pointing to is that we really should be focusing on people in the age group between 40 to 60 with very preventative advice, and very much focused on people over 60 and into later life on some of the assessments and interventions that may be provided. But it is important that during middle age we are giving people advice so that they can moderate their lifestyle then, so that they're living more healthily during middle age and taking that healthy lifestyle into their older age.
Given that the advice is largely the same when you're talking about physical health, is there a specific point in raising the issue of dementia?
I think there is. Firstly, some of the advice is slightly different. The advice around social interaction, about remaining mentally alert is slightly different, and I think some of the advice would need to be modified to make sure it fits around specifically dementia advice, although that doesn't mean GPs would need to change their repertoire or other people in the practice, because the advice is pretty similar. But I think what's evident from some of the research that's been done by the media is that concerns that people have about their mental health as they age mean that some of the advice that we might give may have a greater impact when we're relating it to the potential of getting dementia, because people are understandably fearful of dementia and perhaps will be wanting to be more active in the preventative steps they take than they might around physical health.
And healthy living advice is just as important for people with dementia and their carers.
If you want to keep healthy, do what you feel like doing. As long as you eat right and you have a bit of exercise.
And you don't hurt anybody.
And you don't hurt anybody, and that's the thing. Just work, keep within yourself.
No, nobody's mentioned that to me. I mean, I've drunk heavily through this, which I thought, was well behind me now, and the stress and things, and I've come close to killing both of us. But no, nobody's ever mentioned to me. I didn't know you could.
I pushed the wheelchair. So besides being a chair to sit in, I
Use it as
walked on
support,
and down. And also the other thing is they gave me one of these pusher things at the beginning.
I've got a dog, and quite honestly, you know, without the dog, I probably wouldn't be as fit as I am. And the one thing is, we go for walks with the dog, Joyce and I, and I push Joyce in the wheelchair, which is another good fitness thing, you know. So, you know, I don't feel that I'm getting unfit. Obviously, I could be fitter because I tend to eat too much, but I don't feel that I'm unfit. But yes, you're quite right. It's something I think I've got to bear in mind.